Hi, my name is Justine, and today I am presenting my therapist interview and summary for the psychedelic practitioner that I interviewed. First, I just wanted to introduce the person that I interviewed and give you some background as to how that related to my insights and such. So, his name was Carlos Guzman. He is located in Florida, and the credentials he has is BTTY and IAKP. What that means is that he is not a licensed therapist, but that he is a life coach with the Be True to Yourself coach certification. And what they focus on is transformational coach, which includes courses on addiction and psychedelic integration. Another certification he has is the International Association of Kambo, which is a type of psychedelic substance. It is originally from Brazil and is the secretion of the largest hylid frogs. So just to be clear, he considers himself a coach and not a therapist, which he talks about more later. He's originally from Puerto Rico and he has a Catholic background. His background is in 12-step programs and he was sober for 17 years. So I found this really interesting because I myself have a foundation in 12-step programs and have been sober for almost 9 years. And to hear that someone who was in Alcoholics Anonymous or AA who has now chosen this path was almost very coincidental to me, because psychedelic assisted treatment is something I have been looking into myself for my own therapy. So to have met someone who was sober for 17 years and had got into this gave me some insight. He talked about how within the AA community, how this idea of higher power and how the universe had control over things he struggled with, such as being called an alcoholic, even though that did not define him as a person after some time. So he really liked the idea of finding alternatives to almost take his will back in some sense that has really worked for him. And so he had even told me that, like many of the events he had talked in his life, like even with his Puerto Rican background and having had his family first be very against what he was doing because of how Catholic they were and how over time they had come around and even tried it. So I really get this sense of theme with him that he is really trying to break stigmas and break boundaries within his own identity and such. What substances he practices with include Kambo, ayahuasca, psilocybin, DMT, ibogaine, MDMA, and ketamine. And he also says he integrates meditation into his whole process. So that's just a bit of background about him. So what I wanted to do to kind of show the difference in what we've read in this class and what he practices and how they kind of overlap, I made this chart. So I'm going to talk about it and then later go into more details about the strengths and concerns about this. And this chart can also be seen as kind of the takeaways I experienced with this interview. So the overlap between the two of them that I really heard was this emphasis on set and setting and integration. Even though he's not a therapist, the protocols he takes in order to do treatments with people include a lot of screening for mental health risks or looking at what pharmaceuticals they're on or even looking at what diagnoses they have. So just to be clear, and I'll reiterate this throughout this presentation because he talked a lot about it, is the difference between a therapist and a coach. So for him, and the way he describes it, is that a therapist is able to diagnose and work with mental diagnoses. He does not do that. And even within his practices, when he talks about how he helps clients, is that he never tells them what to do, or he doesn't really necessarily use an intervention, but more so guides the client in helping them find what they need to find. So it's much more about helping the client reach the goal versus working with specific diagnoses or around interventions and diagnoses. But he does play a very big emphasis on set and setting and integration, even though he's not a therapist. And just to reiterate, the set and setting is where one does the psychedelic, and the integration period is how one is able to use that experience into their own therapeutic goals and life. So the second thing where there was overlap is that he pays homage to shamanism and shamanic rituals. It was actually really interesting talking to him because I felt that when it came to plant medicines such as psilocybin and ayahuasca, he really did want to pay tribute to the traditions and cultures behind that. But when he talked about MDMA and ketamine, he said that was more mainstream. So he didn't really see a need to kind of integrate the traditions of that. And then, so as I said, honoring indigenous cultures through its ceremonial use. The way he described a ayahuasca ceremony was very, paid much tribute to the indigenous cultures, and he talked about that. And the last one is considering mental health risks. So one example he gave is if he's working with someone with addiction who hasn't detoxed, he will not work with them. And so now I kind of wanted to compare what we've read in class versus how he practices, which I know is not how everyone practices. So this is specific to Carlos and his work. So in theory, the importance of enhanced informed consent. So some of the articles we've read have talked about, since psychedelics are not legal yet, that an enhanced informed consent is needed due to the subjectivity and intensity of this experience. And so being able to acknowledge things like touch, and especially when someone can touch them and when not, or when risks start to happen, what the client wants. That's something that was said in the literature. Another thing is working off the basis of clinical research and the need to understand personality and value shifts and touch, which goes into the first one. And then lastly, safety and ethical concerns such as minimizing conflicts of interest and avoiding practicing outside one's scope of practice. I think the difficulty with being a coach, as much as he tried to define it as not being able to work with mental diagnoses, there seems to be a fine line, but there really isn't. And the difficulty I had personally with what I read in the literature to what he said is, so how would you define your scope of practice besides just talking about mental diagnoses, because they can be blurry. And so in practice, this is what he talked about that was different from the literature. And that includes not being licensed, therefore does not provide mental health treatment, but reaches clients' goals and optimizes their potential, which I talked about is the difference between a coach and a therapist. He supports recreational use of psychedelics. A lot of the literature we've read have talked about how the recreational use of certain psychedelics not only goes away from its indigenous traditions, but also creates higher risk. But for him, he does support it as long as it's in the right setting, which I think can be difficult as you cannot really enforce or know necessarily. So there's a lot of nuance to what is said in the literature versus what he's saying. He has the belief that pharmaceuticals are just a band-aid, which I also think is very different from the literature, because a lot of the times when we read about certain diagnoses, or even just talking about pharmaceuticals, it always works in conjunction with therapy. And I think for me, it much more depends on the context and the identity of the person versus just viewing pharmaceuticals as a band-aid, as a blanket statement. And then the way he gets these substances, he collaborates with churches for the sacrament, such as Kambo and I think ayahuasca. And then lastly, he categorizes ayahuasca differently from MDMA and ketamine. So again, when I was talking to him, there was this very clear distinction of which plant medicines were considered part of indigenous cultures versus substances that were not. Here I just wanted to emphasize on his integration process of the psychedelic treatment he does. So the important part is preparing for it and what happens after the experience. So for the preparation of the experience, first is creating a timeline to build trust and rapport. Second is preparing for a diet, especially on plant medicines. It's almost like a detox within your body. And each of these points or stages take about a few weeks, as he discussed. And then work in conjunction with a medical team for any pharmaceuticals they have to be off. And then lastly, the coach will be present throughout the preparation. And then for the integration protocol, this is what happens after the psychedelic experience and kind of how he integrates that experience as first, he says clients usually have the honeymoon phase where they're in a state of glow while also experiencing confusion. So not really knowing how to place that experience necessarily. 2 is understanding the mind and the psyche, making sense of what is happening by allowing the client to come up with answers. So here I specifically said allowing clients to come up with answers. And at this point, I also find it a bit discouraging in a sense, because depending on what kind of experience the client had, if it is negative, how do you repair? And that was not really discussed. And then lastly, it's the tap into the emotions, relationships, and continuing to follow up. So from a therapist or systemic therapist's point of view, that would kind of be one of the first things we would address versus the last, especially in how the experiences shines new perspectives onto these relationships, as relationships is where the symptoms start. And then lastly, I just wanted to address the strengths and concerns of my interview with Carlos. So first, his strengths, or that I found, was that he did focus on historical and spiritual implications about the different types of substances, even though he differentiates between some. Another one is that he considers the importance of preparation, integration, and set and setting. And I think that is one key point in all the literature we read. One thing that separates psychedelic substances from other pharmaceuticals is the focus on set and setting, preparation, and integration. He understands the risk of conducting psychedelic treatment with mental health risks. He did discuss that, which is why he does the screening. Another one is that he understands his own self of therapist and what brought him to psychedelic assisted treatment. So speaking about his background and his experience with sobriety and what that meant to him, it seems like he has done a lot of work in order to understand why he does what he does. And he even says that in a quote. He says, "Be involved in the craft with your heart and mind." And I know I can't go off just what someone says, but the fact that he was able to kind of contextualize his experience and how he conducts it showed that his heart was in it, basically. And lastly, he understands the line between coaching and therapy. As blurry as the, I guess, genre of coaching is, I was glad to hear that he saw the separation between therapy and coaching in his eyes. So at least there was some sense of ethical consideration. As for the concerns I had is 1, safety and ethics, legally practicing outside one's scope of competence, interpersonal dynamics, intensified, and lack of accountability leading to ethical violations. So I think the difficult thing when it comes to being a coach is that because there's no code of ethics and you're just getting a certification, it's like, where are the boundaries of what you can do? And while he said he does that, legally speaking, what could happen if he did violate an ethical consideration? So that was just when I think of the difference between a coach and a therapist. The second thing is a lack of participation in clinical expectancy. So because he doesn't have the background of being a therapist or necessarily understanding how to read clinical trials or having the training we do, where is his knowledge or his understanding coming from? Is it just from him? Because a lot of what we learned is being challenged and being critical, and I don't necessarily know that is part of a coach's training. Another one is self-categorizing drugs in terms of what is considered sacred and not. I know a lot of attention has been played onto plant medicines, but that doesn't mean there isn't a background for things, substances like MDMA or like ketamine. And just because we categorize certain ones as more sacred, that in itself is almost dishonoring the history of other drugs, and also wondering why it's important to value these as indigenous knowledge but not other drugs. Another one is psychedelic exceptionalism. So throughout what he was saying, I could tell that he very much believed that the future of, medicines or what could heal people are plant medicines, and even the way he talked about pharmaceuticals. So in that, there is this almost, I can't say he has the ideology, but there is this feeling of almost that psychedelics are sacred and important and the normal rules don't apply by just saying that pharmaceuticals are a Band-Aid. So there's a lack of nuance in understanding how different types of medications or substances can help different people. And the last one is the use of recreational use, the nuance of recreational use, which I think is a gray area, but it can be difficult when you are trying to help people utilize this as a medicine to help versus doing it for fun. So that was a concern of mine. So that was pretty much my discussion with him, and I hope you enjoyed it, and here are my references. Thank you.